You know, it's time to bring in Dr. Joe Congeni from Akron Children's Hospital Sports Medicine Center. If you're new to the show, Dr. Joe joins us each day, each Wednesday at this time for great useful information in the world of sports medicine. And Dr. Joe, where do you want to start today?
Well, Ray, I mean, what the heck? This is the beginning of it all. The fall season of sports is upon us, and kids are excited down at our office, and everybody's ready to roll, and high school and college and professional that we like to watch and get some enjoyment out of is all about ready to start. But one of the issues is we have so much excitement in this community about our Cleveland Browns this year, right? There's no doubt about the excitement in this town. It's palpable. But one of the problems maybe that people worrying about is they had a pretty healthy camp. But one of the problems is a press conference I heard earlier this week, we have 8 players that were not playing that are sidelined because of hamstring injuries. Hamstring injuries and 8 players. Should we be worried about that, Ray?
Yes.
So here's the deal. We're getting close to things moving on in the season. Probably one of the best descriptions I heard of it this week was from a very, very smart football coach we have by the name of Kevin Stefanski. And he talked about how these people train so hard year-round. Not just the pro players, but the college and the high school kids train too. But football, playing football, is really different than training. And the things that are different, 3 really things, is that when you're playing the sport of football, you have to react and burst, he called it. It's a really good description. It's different than just training really hard in a workout room or a PT center or in a fitness place. React and burst. Number 2, rapid change of direction in the sport of football when you're really on the field. Number 3, you have to stop very suddenly on the football field and soccer field as well. We see these injuries a lot in soccer as well, and you have to stop very suddenly. And when you do those 3 things, it puts an inordinate amount of stress on the strong strap muscles around the thigh, especially known as the hamstring muscles. And the hamstrings are made up of 3 really strong muscles in the back of the thigh. 1 big strong one on the outside and 2 on the inside. And these muscles are really prone to being overloaded. They get micro tearing or tearing, and we know about hamstring injuries, and they can tear in a few different places. They can tear. A lot of our really young kids in junior high and early high school, they tear up at the top of the tendon and the muscle where it attaches up in the buttocks and the pelvis. Sometimes they even pull off a piece of bone or growth plate up that high. A lot of our athletes that have been around a lot longer, they tear where the muscle and tendon come together a little bit lower down in these strong muscles. And then there's some people that tear right in the belly of the thickest part of the muscle. And we know that the treatment is typically physical therapy. We start in our kids who care about getting moving and they have a bad hamstring injury that's limiting them with muscle stimulation, massage, compression, deep tissue treatment. They wear a sleeve or a wrap, now dry needling and other things that we can do in a physical therapy center to try to get them moving in the first few weeks. But we know, unfortunately, that many of these injuries last longer. And kind of one of the cutoff points for us is if it's not getting better or actually getting worse in the first 6 weeks, we may need to look at this thing a little bit more. When it gets over a month or a couple of months, we sometimes even will look at an MRI to see if we see some tearing in that muscle and some scar tissue. And when it gets into a matter of 4 to 6 months, then almost always there's kind of a wad of scar tissue in there. And so I just wanted to go through with you today 2 newer techniques that people are using in treating hamstrings so that your audience is so good about knowing sports things and so well informed by you. Number 1, and this could be filed away by different trainers and high school coaches and others, is the technique that's used in the off-season to prevent hamstrings. It's obviously not 100%, but everybody should be aware of this newer training technique known as Nordic hamstring exercises. This Nordic hamstring curl or eccentric curl, if you go to almost any gym or workout place or PT place, you'll see kids and athletes training with this Nordic hamstring exercise. And so what it is these athletes kneel on a pad, and they lower themselves very slowly to the ground with a partner holding them at the ankles. Sometimes if they don't have a partner, they may use a barbell to hold them. But you'll see these people. It's hard to explain on the phone right now. People can look up Nordic hamstring exercise. But for people in these sports with rapid bursts and reactions, this is a really good off-season exercise, and they ought to look up Nordic hamstring exercise or Nordic curls. They have gone a long way. One study showed 50% reduction in hamstrings in people that use Nordic curls in the off-season. The second thing I wanted to talk about that's relatively newer in hamstrings is typically we know in the first few weeks we try traditional physical therapy. If that's not working, we know in the last decade there's been this talk of a shot called PRP that you and I talk about. But a third technique that I want to have your audience understand, it's a big medical word, sorry about that, but it's called tenotomy. It's part of a series of treatments called minimally invasive techniques that we use. And they actually use they use the ultrasound machine, which has been so helpful to us in sports medicine to locate this wad of scar tissue. And then they make a very small puncture in the skin. And what they do, they go in with a small unit that they use to break down that scar tissue, to remove that scar tissue, and to promote bleeding, which will promote healing. And that is called a tenotomy. And so you may hear of people getting minimally invasive technique tenotomy if it's been months that they've been struggling with their hamstring. We don't do traditional surgery anymore, but this tenotomy, and starting in 2011, has become a technique that's used a lot in serious athletes. You have to be a pretty serious athlete to get this done. The negative, Ray, is it's a minimum of 6 to 8 weeks before you play again. So the old shot with cortisone, people played within a week. And the old shot with PRP, they played in a couple of weeks. This is a minimum of 6 to 8 weeks. So the biggest mistake people make is they get back out, they start to play and run, and the hamstring's bothering them again. And then they come in on August 15th and say, hey, I want that technique done. It's too late by then if they're going to be ready for the season, because it's going to take a couple of months to recover from this technique known as a tenotomy. So 2 new things today for your audience. Be aware of the Nordic hamstring curls. They're an off-season workout that people should use to try to prevent hamstring problems in soccer and football players. And number 2, be aware there is a newer technique for more chronic wad of scar tissue that people get in that hamstring known as tenotomy, and it's a technique that's useful for a lot of athletes in keeping your athletes up to date. But let's hope those 8 athletes are ready to get back on the field very soon and help our Cleveland Browns have one of the most successful seasons that we're all so excited about.
Dr. Joe Congeni with us, Sports Medicine Center, Akron Children's Hospital. Joe, hold on with me. I have one follow-up question. Joe, this is something you and I have talked a lot about in the last few years. I'm sure you saw that Brett Favre came out yesterday, and he was recommending no tackle football until the age of 14. He's had his own problems since retiring from the game. And I know you and I have talked about some states, Oregon, Utah, California, have started at the age of 13. What is research? You're right in the middle of Sports Medicine Center. What is research, and what are you hearing around the country as far as tackle football being lowered in ages?
Unfortunately, Ray, I would love to give you one simple answer of what research shows. But there is a lot of research going on. Of course, people are looking at flag football as a good alternative for people. Of course, people are looking at injury rates. But it's very hard because we're trying to look down the road for a lot of these things, like what Brett Favre is talking about, and trying to project what do these people look like when they're 18 or 25 or 30, what's going on, and let alone musculoskeletal injuries like we're talking about today. So what do their bodies look like? How much arthritis do they have later on? What about the head injuries? I definitely think one thing the research is showing is a reduction of hitting in practice. And I think although the research research is across the board. I think one of the things that maybe COVID taught us is we definitely, even at the professional level, do not have to do as much contact work and hitting in practice. And so we carried it over to the high school setting this year, and we'll see kind of what the results of that show as well. But I think one thing that's without question is that we could really do a better job reducing the amount of hitting and contact and collision work that we did with kids at younger ages. This could definitely be limited and cut in half or more, and we could still try to save the sport.
And, Joe, one thing that you've been very good and you educated me on, because a lot of people will go to the big blow as far as the concussions and the head injuries, but you're also quick to point out it's the years of blow that also add up with these kids.
It's a cumulative effect. There's no doubt. That's the scariest part, and we don't know about that accumulation. So we need the rules changes and the officials, and that's what I'm always watching closely. And for a couple of years, I was kind of a little bit frustrated there. I didn't think they would talk in the off season about limiting those big hits, and then I didn't see it during the regular season. I've got to tell you, the officials are doing a better job, I think, at all levels of football, of trying to limit the big blow, the snapback hit, that we talk about all the time. And we've seen it even in some very big games, national championship games, where they have removed players for that big hit. So I think we're getting better there as well, finally. And you're exactly right. It's got to be eliminated from the sport, or the sport's not going to survive.
Joe, great information this morning, my friend. Thanks for the visit. As always, I appreciate you making time, and we'll get together again next week.
Thanks, Ray. We'll talk to you next week.
You got it, my friend. There you go. Dr. Joe Congeni, Akron Children's Hospital Sports Medicine Center, joins us live on Wednesdays. We're 7 minutes already in front of 9 o'clock at WAK.
Home. It looks a little different for everyone. For some, it's a rustic cabin. For others,